Hello, to begin this presentation, I will give a disclaimer that this is a student presentation using a hypothetical scenario about a fictional hospital in a state that is not my own. I am a student at University of Arkansas for Medical Sciences, and the information in this presentation does not reflect the views of UAMS. So today we will be talking about lead-based paint exposure in the hospital setting. I'm Mackenzie Gakey. I'm one of the occupational health specialists employed here at Eternum Vale Hospital in Madison, Minnesota, and I will be talking about how you, as new maintenance workers, can be exposed to lead while working, what health effects lead exposure can cause, and how you can keep yourself safe while working here. So we will start out by going over what is lead. Lead is a naturally occurring metal that is part of the Earth's crust. It is found naturally in the air, soil, and water, and it can get through different ways, mostly being industrial mechanisms that take it out of the ground, and then it ends up being put into the air, and then it can get into the drinking water as well as staying in the air. Because it is so prevalent, we all have very small amounts of lead in our body that we acquire from eating and drinking the food or water that contains the lead, or by breathing in dust that has small amounts of lead. This is normally fine and causes no health concerns, but significant health problems do arise when your body contains very high amounts of lead for short amounts of time, or if you just get more than the normal amount of lead coming into your body for a very long period of time, such as every day at work. So next, we will talk about how you can be exposed to lead in the workplace. Lead was used in paint until 1978 when the U.S. banned it. Eternum Vale was built before 1978 and has several buildings and facilities that still have paint that is old enough to contain lead. So when you do repairs on the older walls, you will likely be exposed to the lead-containing paint. Some of the actions within your job description that can cause exposure include painting over old paint, scraping paint away and handling chipping, peeling or cracking paint, such as in the photo, and sanding walls and furniture. However, I don't want you to worry because we are committed to providing safeguards so that you do not face health consequences as long as you comply with them. To continue, sanding paint is one of the biggest ways to get exposed to lead in the workplace, and one of the easiest ways if you don't protect yourself, so I want to expand on it further. When you're sanding, the paint gets broken up into tiny particles that can float around in the air and stick to everything. You can see in the picture on the left, there's tiny particles that are falling off of the ceiling and onto the floor where he is standing. So you can imagine if you were to blow a bunch of glitter into the air, you can never clean it all up and you will be finding glitter for years. The little specks of glitter, if you think about it, they stick to your body and your clothes and they're just everywhere. And it's the same thing with these tiny particles of lead containing paint. Once it's in the air, you can inhale it into your mouth, which is from breathing. And when it is in your mouth and nose, it can be then swallowed into your stomach. And it's really impossible to prevent this from happening unless you wear the proper protective equipment, such as what he is wearing in that photo. And this equipment will be available to you. However, we can't force you to wear it. We're not there all the time supervising you. So you have to make sure that you are doing the right things to protect your health. But all of this is clearly stated in our hospital's policy, and you are required to do it. Now we're going to change gears and talk about what happens in your body when you are exposed to lead. Symptoms can start within days to weeks of exposure and may affect many different organs in your body. You can develop abdominal pain, constipation, and anorexia, which basically means you lose your appetite for food and you don't want to eat. You can also develop severe fatigue, have trouble sleeping, and decreased libido. Additionally, you can develop frequent and severe headaches, as well as difficulty concentrating and problems with short-term or recent memory. You could also become very irritable or depressed. With mild to moderate exposure, you might not develop any of these symptoms, but most people develop some of them. You may not even notice them at first, but the damage is still being done to your body. Then, if the lead levels in your body get severely high, really quickly, you can become really confused to the point where you develop seizures or go into a coma. Now we'll talk about the chronic effects of lead exposure. So since it can get into all organs and all parts of your body, even if you just have moderate to small amounts of lead in your body over time, so over months to years, such as if you're continually being exposed to lead at work, it can affect your health in the same ways that it would if you got a really large amount of lead just for a short period of time. The lead can get into your DNA and cause changes, and that's how it causes so many effects. Because of this, studies have been shown that even a very low lead level over several months to years is associated with increased risks of all-cause mortality, as well as cardiovascular mortality, which means dying from any cause, but also dying from like from your heart. Chronic exposure can cause declines in neurocognitive functioning to the point where you won't be able to think as clearly and likely will always have some degree of brain fog. It can also cause a tremor where your hands will shake all the time, as well as peripheral neuropathy that may cause you to lose sensation in your hands or feet. Chronic exposure to low levels of lead can also cause you to become anemic, which means you have low level of blood cells in your blood. And it has also been widely shown that lead in the blood causes hypertension, which means high blood pressure. The high blood pressure causes your heart to have to work too hard, which can cause heart problems over time. Hypertension also increases your risk for serious complications such as strokes. Lead is also hard on your kidneys, which can cause them to not work as well over time. Lastly, lead can change to the shape and morphology of your sperm, as well as decrease the number of sperm you have and their ability to move, which this can make it difficult for sexual partners to become pregnant. Speaking of pregnancy, pregnant women have different health concerns than all other adults when it comes to lead exposure, and so we will talk about them very briefly just in case any of our female workers are pregnant or may become pregnant while working here. If you're exposed to lead while you're pregnant, it increases the risk of spontaneous abortion, which is when you lose your baby suddenly, preterm birth, and babies that are small for gestational age. Babies that are exposed to lead while developing in the uterus have lower IQs and impaired cognitive development than babies that are not exposed to lead. All of this is to say that if you become pregnant, be sure to tell your doctor about your job so that they can periodically check for lead in your blood. Also, tell us as soon as you know so we can keep you away from jobs pertaining to lead-based paint in the hospital. I know all of these effects sound scary, so now I want to reassure you by talking about epidemiology related to lead exposure, both in the United States and also here in Minnesota. In the United States, the National Institute for Occupational Safety and Health monitors trends in workplace lead exposure. The graph here shows the number of people who had measurable lead levels greater than 10 micrograms per deciliter, which is the dark line at the top, and also greater than 25 micrograms per deciliter, which is the lighter bluish line towards the bottom, and this was from years 1994 to 2020. You can see both of the lines decrease over time, which shows that the amount of lead exposures from 1994 to 2020 has decreased over time. And the amounts that they chose were amounts that have been scientifically proven to cause effects on your body. So you can also see that there were more people that had greater than 10 and less people that had greater than 25. And as you get more and more lead in your body, so going from 10 to 25, that's where you would get more effects. So from the graph, it looks like more people are exposed to more lead than normal, but not quite as serious, since the darker blue line is towards the top. Now we can look at the epidemiology of lead exposure in Minnesota, where we are. And you can see from this bar graph that the trends have been relatively consistent, just because this is mostly a straight line. It does go down a little bit, but for the most part, there hasn't been much of a decrease. And the light blue represents occupational cases, so people getting exposed to lead at work. And this is from 2010 to 2020, so a little bit less time. Fortunately, most of the occupational exposures are not done in construction or maintenance settings, which is what you will be in, but it still shows the importance of protecting yourself while on the job, which we will discuss next. So, as we have learned, breathing lead particles is the most common way for you to be exposed to lead. When you think you'll be working with old lead-containing paint, you'll want to use plastic sheets to contain any lead particles to the room that you are working in. This helps ensure that the lead will not go into the air and affect people who are unaware that lead-based paint is nearby, people that have weaker lungs, stuff like that. This is especially important in a hospital setting where most of the people in the hospital are sick to begin with. Second, you will also need to wear eye protection and a respirator mask when you're working with lead paint. You can see a mask in this picture here, and those will be similar to what you will be wearing. These are required by OSHA, which is a national organization that works to ensure environmental safety for all Americans. Because they're required and because we know it is important, we will provide the materials to sequester off the rooms, as well as the respirator masks for you. When you start working, you'll get fitted for this mask, and we'll make sure that you wear the same one with that same fit each time that you need to use it. And we will also train you on how to put it on and wear it properly so that you can put it on yourself each time. Next, you will also be provided disposable coveralls and these shoe covers that are to be worn and thrown away as soon as you leave the area where the lead-based paint is. You also will need to take a shower as soon as you're finished working with lead particles and wash your clothes once you get home. Even though you're wearing the coveralls, lead particles can get in anywhere and they can still get on your clothes. So it's important to not wear those same clothes multiple days or put them back in your closet, because washing it ensures that the lead-containing paint particles don't spread to your home, your car, your home, the other clothes in your closet. And there are showers and dressing rooms in our facility that are available for you to use for this purpose. Lastly, it's important to just not eat in a place where you're dealing with lead-based paint. Lead consumption is usually not a major route of absorption for adults, but it can become really significant if an adult is eating in a lead-contaminated environment or eating with their hands or using utensils without properly washing their hands in between. So, lastly, we'll talk about what to do if you think you have been exposed to lead. The first thing you should do is let us know. We're in the Occupational Health and Safety Office in the hospital, and we will work together to create an appointment with employee health, also here at the hospital, and that will not be a cost to you. And second, don't panic. Accidents happen. Small amounts of lead exposure are not going to cause significant amount of harm, but it is important to be aware and to prevent those exposures when you can. So here are my sources. Most of my information came from the CDC, as well as the EPA and Up to Date, which is a resource that is peer reviewed for doctors. Thank you.